So now let's start with the landmark which we can identify over the anterior knee. So all those landmarks basically marked here already. This is the location of your suprapatellar bursa. This is representing the infrapatellar bursa. This is the location of your patella. This is the joint space between tibial plateau and femoral condyle. This is the lateral side. This is medial side joint space, and this is the location of your tibial tuberosity, and this is your ligamentum patelli. So let's start first to identify the most important landmark or bony landmark is the identification of patella. It is as we all know that anterior, medial, or lateral, almost all the aspects of knee joint have several pathological conditions and we encounter in daily practice. So first let's start to identification with localization of bony landmark which is easy to identify and which is related to the patella. Here we can see two bony landmarks. One is your patella and second is your tibial tuberosity. The rest two landmark is basically this distal femoral condyle and tibial plateau. So let's start to identification of the patella. So first of all, we can very easily identify the base of patella. As we all know, the patella is basically placed in the body like a inverted triangle. So base is found in upside and the apex is found in the distal side or lower side. So first of all, for identification of base of patella, as we all know that it is a structure which is categorized as uh, bony edges. So for bony edges, basically we use the fingertip and the direction of palpation, it should be perpendicular to the structure. So first of all, place your finger like this about 3 to 4 centimeter proximal to the presumed location of the patella or base of the patella like this, and then passively we have to perform the extension of the knee. Mind it, it should be passively. And what will happen while performing this passive knee extension? Basically, patella will track in upward direction. And if you ask the subject to perform it actively, so automatically the quadriceps will contract and it will interfere with your palpation. So for that, to minimize the interference, we have to just place the hand like this and don't ask or even ask the patient to remain relaxed, and you have to passively perform this extension. Now at this range I can feel the base of the patella. It is over here. You can see the movement of my finger pad. It is coming out, it is going in because it is soft tissue or it is the location of quadriceps, and it is coming out because of the presence of patella. So I have already marked the proximal edge or base of the patella. After identification of the edge of patella, we can slide our thumb pad medially as well as the laterally. So just follow it medially and laterally, and ultimately we will reach over the medial and lateral pole of the patella. Next structure that we can identify is the medial edge or lateral edge of the patella. So further, if you follow the bony edge, ultimately we can reach over the apex of patella. So the complete patella can be identified with this palpatory technique, and all these techniques should be perpendicular to the structure. Next, alternative method. If suppose your subject is complaining the problem is related to the apex of patella, so we don't have to follow all these steps. We can identify directly the apex of patella with the help of another structure, that is your ligamentum patelli. So how? First of all, you have to identify the joint space. It is very clear at the level of apex of patella. Just slide your, I can identify the femoral condyle over here. Slide your thumb pad over the anteromedial or anterolateral aspect of the knee toward the downward direction, and ultimately the thumb pad will dip down because of the presence of joint space. In knee flexion, because the subject is seated in high sitting, so it automatically is open. So it is a gap we can feel over here, and here I can feel the proximal bony uh, consistency. There is a gap, and after that another bony consistency again I can find. So this proximal consistency is basically, it is because of the presence of the femoral condyle, and the distal consistency, it is because of the presence of tibial plateau. Same way we can repeat over here. Just slide your thumb pad or finger pad in downward direction and identify the joint space. Same way here it is femoral condyle and it is tibial plateau. After identification of these, means you have to clear that it is the location of your joint line. Just crossing the joint line, bring your finger pad from medial to lateral direction with gentle pressure, and it will encounter with a elastic structure or elastic consistency because of the presence of your ligamentum patelli, and basically it will be your medial edge of the ligamentum patelli. So just I can mark it completely proximally and also distally. The same procedure I can repeat from lateral to medial direction. Again, you can identify the lateral edge of the ligamentum patelli, and you can identify it from the apex of patella up to the tibial tuberosity. So this is the location of ligamentum patelli. So first identify the ligamentum patelli. Now put your finger over the ligamentum patelli like this. From here, apply firm pressure and slide your thumb pad proximally, and ultimately you will reach over the apex of patella. See, again you can observe the movement of my thumb pad. It is coming out, it is going in, again it is coming out, it is going in. So this is the location of apex of patella. Same way, from the starting position, from here you can slide your finger pad in downward direction, and ultimately you will reach over a bony prominence. For confirmation, you have to perform circular palpatory technique and identify a bony prominence which is little bit larger and protruded from the rest of the bone. So by performing this circular palpatory technique, you can identify the location of the tibial tuberosity. So with the help of the ligamentum patelli, we can identify the both landmark, means the apex of patella as well as your tibial tuberosity. And all these landmarks have its own clinical importance. Two more landmarks I would like to discuss. One, here you can see, basically it is the anatomical location of your intrapatellar bursa, but we can, for identify this structure, you have to experience, otherwise in normal circumstances we cannot identify a normal bursa. If it is inflamed, then only the size getting larger, and the second thing, when you apply pressure over here, the patient will complain of tenderness or pain. Same way, from the base of the patella, just proximal to the base of the patella, this is the location of your suprapatellar bursa, and like the infrapatellar bursa, you can only identify this structure in case of inflammation or any pathology related to this. We have, as a student in applied anatomy, we have learned about the housemaid knee and clergyman knee. Basically, these two condition is related to these bursa. So it's all about the palpation of anterior knee. That's all.